Hi, I'm Megan Petroselli. Welcome to our project. I am a nurse in the emergency department, and I also work at a pediatrician's office where we see lots of newborn babies.
And my name is Christine Van Vliet. I'm the nurse manager of maternity and NICU at L&M.
Okay, so our project is on the implementation of delayed immersion bathing. So to back up real quick, the project is a change in evidence-based practice. Prior to this on the maternity unit, the previous practice was to bathe the infant using a sponge bathing technique within 2 hours of delivery under a radiant warmer. And then after January, they changed and practiced to a technique called the Wait for 8 campaign, where they waited for 8 hours post-delivery and they performed a sponge bath under a radiant warmer until the baby was reached a temperature of 36.8 degrees, where then they would return the baby to the mother, all of which were done away from the mother.
The best practice recommendations and the significance of our implementation is based on A1's 2015 Wait for 8 campaign, which promotes breastfeeding with uninterrupted skin-to-skin time, decreases the risk of hypothermia, decreases the risk of hypoglycemia by not stressing the baby out by giving the baby a bath so early, and increases parental satisfaction.
So we decided to implement our scholarly inquiry project in the spring and March of 2018, and our PICO question was, will a pilot test of delayed immersion bathing result in an actual practice change at our facility?
So we followed the MSN essentials for our course. So essential number 7 is interprofessional collaboration for improving patient and population health outcomes. This recognizes the master's prepared nurse as a member and leader of interprofessional teams, communicates, collaborates, and consults with the other health professionals to manage and coordinate care. So first we needed to identify the stakeholders, who obviously were the staff nurses on maternity. We identified champions for each shift. They helped us disseminate surveys and they demonstrated baths. Our lactation consultant, Kathy Mason, was instrumental in our project. She collected breastfeeding data and also did some demonstrations. Infection prevention colleagues, Kathy Carboni and Donna Nucci, they both did some research on the best cleaning products for the tubs, best practices to clean the tubs, and are helping us to investigate whether we should go to single-use basins. Supply chain, they helped us out with purchasing the tubs and thermometers. And me, management, I was supporting and leading the team. So leaders of interprofessional teams, collaborators, and coordinators. Our initial meeting was with Kathy Mason on April 9th. We sat down and devised our plan of how we're going to implement and what our timeline was. Pilot dates originally were going to be based on last semester, so we're originally going to implement this last spring. We decided to wait until August to align with this course. And the tools we used to assess and evaluate were temperature logs analyzed using Excel and parental surveys evaluated using the Likert scale.
All right, we also looked at the MSN Essential 4, which is translating and integrating scholarship into practice. So this recognizes that the master prepared nurse applies research outcomes within the practice setting, resolves practice problems, and works as a change agent and disseminates results. So to help us fulfill this, we did a substantial literature review in order to implement best practice. Through our literature review, we were able to find research which showed that the bath directly associated with increased initiation of breastfeeding and increased rates of breastfeeding. There is also best practice research that delayed immersion bathing decreases rates of hypothermia and increased parental satisfaction. There was staff were able to implement policy changes related to infant bathing in a 2-week period without any negative outcomes. There was also a random controlled trial study that showed reduced variability in temperature and higher post-bathing temperatures in infants receiving the delayed bathing. There was also a research that showed that there was a suboptimal thermal care occurring within the sample, so that there was a need to educate on bathing practices to help the infants better thermoregulate. So change agents. So in August, we really took a look at implementing this immersion bathing as a practice change on the unit. There, we looked at putting out education. So there was email sent out to the staff that there was going to be this practice change going on. There was instructions on the surveys that were handed out to the parents through the staff. There's education on the temperature logs that we were put out both pre-implementation and post-implementation of the practice change. The purpose and the timelines were shared via PowerPoints and through staff meetings and huddles. And then we disseminated results. So the staff meeting was held on September 5th, and there was some feedback given to Christine from the staff. They had some mixed results as to kind of how they felt on that. There was the staff champions were assigned on each shift. The feedback during the month of September was given. You gave that to the staff, right?
Yeah, and they requested some step-by-step procedures, so I created a PowerPoint that went along with Mosby's to discuss the step-by-step procedure of the implementation of the bath. And I personally demonstrated the immersion bath and cleaned the tub with 2 separate babies.
So see one, do one, not teach one, right?
Exactly.
And then there was a staff meeting held on October 3rd, which we were able to give out the results of that we gathered all the data, and she was able to show the results of the survey, the logbook, and then the breastfeeding results were shared that we took and gathered. She was able to provide results for the questions the staff had on giving the tub use. She's looking into maybe giving single-use tubs instead of just cleaning the tubs. And then there was actually a question that came up regarding community pediatricians and what they're recommending for post-discharging of the babies and how they're sending the babies home and what they're doing with the baths after they leave the hospital. So she is working with the pediatricians to kind of have a meeting and figure out what that kind of education is looking like as well. And this is a nice little graph and showing how the results kind of played out. So post-bathing temperatures had significantly increased in the babies. There's a reduction in the decreasing of temperatures. Parental satisfaction has increased, and essentially the breastfeeding rates on our unit has stayed the same. And resolving the practice problems. So again, she attended the pediatric department meeting to discuss what their post-discharge instructions were with the newborns. She set up a meeting for October 9th with the supply to talk about the basins and infection control to discuss about cleaning the tubs, which are the biggest issues that arose.
So MSN Essentials number 8 is Clinical Prevention of Population Health for Improving Health. This recognizes that the Master's Prepared Nurse applies and integrates broad, organizational, client-centered, and culturally appropriate concepts in the planning, delivery, management, and evaluation of evidence-based clinical prevention and population care and services to individuals, families, and aggregates identified populations. So planning, our timeline. Our first meeting, like we said, was April 9th with Kathy Mason, Megan, and I. We created tools based on validity. We structured our time frame for data collection in the pilot, and then we readjusted to align with the course. We identified our stakeholders, and we devised a plan to provide staff information to be given via email and at staff meetings. Our sample population was pretty clear. Our pilot was to include term newborns on both primips and multiples, post-vaginal and C-section methods of delivery. We identified breastfeeding and bottle feeding on admission. We excluded newborns who were going to be admitted to NICU, newborns that were in the hypoglycemic protocol, which means infants born to diabetic moms or infants that were SGA or LGA, and our NAS babies, those are the drug withdrawal babies. Infants who have been identified and that are contraindicated for delayed bathing, which are infants born to HIV mothers, Hep C moms, or infants that are born with thick meconium.
Evaluation. So post-implementation of delayed immersion. Again, the temperatures have increased in our sample population post-bath. Parental satisfaction has increased post with the immersion bathing technique, and the breastfeeding rates were not really impacted on our unit.
So our next steps, I'm going to meet with the pediatricians to provide consistent discharge education to our mothers post-discharge, purchase individual basins to be used for immersion bathing, invite infection prevention to my November staff meeting to discuss cleaning the reusable tubs if we're not successful with getting the individual basins, replay the immersion bath procedure PowerPoint and disseminate to all staff via email, continue to challenge the staff and healthcare team to implement best practice changes on our unit.
And what we learned that to create the surveys in the logs that are validated are important. We learned how to create an abstract that pulls in the reader to disseminate our results. We also learned to pull in all of our data, our background information, our interventions, outcomes, and implementations, and put into one poster to provide education to our peers on the evidence-based practice implementation. We also learned about who the stakeholders are and how to work collaboratively and effectively in a relatively short period of time. We also learned how to work together as a team to bounce ideas off each other and learn from each other. So this was definitely a great learning experience for both of us. We learned a lot from each other. So.
And we also learned that the only person who likes change is a baby with a wet diaper. We hope you enjoyed our presentation.
Thank you.